Hi, my name is Crystal, and the topic that I chose to do was multiple births. Multiple birth is defined as giving birth to more than one baby at a time. That includes twins, triplets, quadruplets, and etc. Um, Lately, there has been an increase in multiple births. Since the 1980s, there has been a 70% increase. And out of the 70%, only 2% were naturally conceived, which means the remaining 68% involved assisted reproductive technology. Assisted reproductive technology is the treatments that help with infertility. Some of those treatments include intrauterine insemination, injectable medications, and the most popular one is in vitro fertilization. In 2011, 46% of multiple births involved in vitro fertilization. The reason for the controversy behind multiple births is the risks that it puts for both mother and the baby. Also, another controversy or concern is the financial constraint that it has on the family in raising and having more than one baby at a time. Some of the risk factors include premature labor and premature births. The risk of having a premature birth means like the baby are born with low birth weights. They have a higher chance of being jaundiced and having to use antibiotics, and they also have a higher risk of neonatal death. Neonatal death is defined as the death of a baby within the first 28 days of life. There's a major risk for the second baby than the first. There is a 72% chance of perinatal outcome versus the 67% it is for the first baby. Also, there is a high risk for the mothers as well. Mothers who carry multiples end up having a overstretched uterus. And when you have an overstretched uterus, it causes the uterus to contract before the pregnancy reaches full term, which leads to having premature labor. And then since the mother's uterus was overstretched, they can experience postpartum hemorrhaging, which is heavy bleeding, like severe heavy bleeding. Also, mothers are at risk for preeclampsia, which is a conjunction of high blood pressure with protein in the uterine. And they are also at risk for gestational diabetes. As far as financial burden goes, sometimes mothers who are pregnant with multiples are admitted to the hospital early just to be watched, to make sure that they are safe and their babies are safe. But there has been no evidence to support the benefits for this for either the mother or the baby. Also, the cost of the baby being in the NICU exceeds more than $3,500 per infant, and depending on the time length that they stay, sometimes it could reach $1 million. Also, having more than one baby, you'll have to spend an excessive amount of money on diapers, wipes, formulas, clothes. Sometimes the mother or the father stays home, which involves like a loss of income. And sometimes they have to hire help, even though they quit their job. So the opposing evidence, so the benefits of using assisted reproductive technology is it helps people who struggle with starting a family. 9% of men and 11% of women experience fertility problems. Also, using fertility drugs allows you to wait later in life to start a family. So you don't have to, so you can be career focused and you're able to prepare your finances for having a baby, especially if you're having multiples. Also, it's an increased chance of conception when you use assisted reproductive technology, especially in vitro fertilization. Like there's a 30% chance of women conceiving multiples. And also, if you complete 3 full cycles of IVF, there's a 45% to 35% chance of conceiving a baby in general. The refutation of this is the longer you wait, the harder it is to conceive, not just naturally, but with IVF. For instance, women ages 35 to 37 only had a 41.1% chance. A 41.1% live births, a percent of live births, whereas versus women who were 43 and up only had a 4.2% chance of live births. And then women who conceived multiples, 35 to 37, had 9.1% versus women who were 38 to 40 had a 5.3%. It also can take up to 5 to 6 cycles of IVF to become pregnant, which is about the same time it takes for couples to conceive naturally, which is about 2.5 years. And the cost to get pregnant with IVF is anywhere between $12,000 to $17,000 per cycle, and that is not including medication. So, in conclusion, people should, in my opinion, people should only use assisted reproductive technology when necessary. Like if they have there isn't any other option and they're having a really hard time getting pregnant the natural way. If they choose to go the IVF route, the doctor really should only implant 1 to 2 embryos at a time to decrease the chance of having multiple babies, whereas the original 3 or more. Also, the more babies the woman is pregnant with, the higher her risks are. There's a significantly higher chance of having preeclampsia, gestational diabetes, hemorrhaging when you're pregnant with 2 or more babies, especially triplets and quadruplets. But in reality, the older you are, the harder it is to conceive naturally or with the use of IVF or any other assisted reproductive technology. That brings me to the end of my presentation. Thank you and have a good day. Bye.